South Korea has seen fewer than 1,000 cases of COVID-19 for a second day in a row. For more on this, we have our Kim Do-yeon on the line. Do-yeon, this is a small improvement, but a step in the right direction.
Mark, South Korea reported 840 new cases of COVID-19, of which 809 of them were local transmissions. Most of those new cases were from the capital region. 25 more patients are in a critical condition, bringing the total to 411. Despite this, the health authorities say the strain on medical infrastructure is easing. During the briefing, the health authorities acknowledged the downward trend.
The average number of new cases in the past week has fallen into the 800s. It shows the current trend is downward and is past its peak. However, considering the slow sign of spread in the local community, the decline is expected to be slow.
Okay, Do-yeon, so the trend for this third wave, anyway, appears to be slightly positive, but the government is not letting its guard down, neither is the public here in South Korea. Officials are making improvements to try and prevent cluster infections breaking out at facilities where there are a high density of people.
Mark, currently South Korea is seeing clusters from mental care hospitals and a detention center. So the government has put forth new measures to quickly respond to an outbreak. First, for the mental care hospitals, residents who test positive will quickly be transported to other designated medical facilities. For example, the ones with mild symptoms will be moved to certain mental care hospitals that are prepared to care for the patients with COVID-19. Those who are critically ill will be transported to an infectious disease treatment hospital. The ones that came in contact with those infected will also be quarantined at designated mental care hospitals. As for prisons and detention centers, the authorities are testing officers and inmates frequently. In addition, one mask will be provided to inmates each day. As for Seoul's Dongbu Detention Center, which reported more than 1,000 cases, the density has been lowered significantly to protect the inmates and to isolate those with COVID-19. That's all I have for you at this hour. Back to you, Mark.